Older couple walks into the doctor's office. Old man and his wife. Doc says, I need a stool sample, a urine sample, and a sperm sample. And the guy's a little hard of hearing, so he says to his wife, what did the doc say? And she said, hand over your underwear. Is that good? All right. Has nothing to do with heart disease. Most of you know me. I'm not a cardiologist. I'm supposed to do some sort of disclaimer that this is all my opinion, and take it for what you will, but the reason I like talking about this kind of stuff is that are there any cardiologists that are sitting down and doing talks like this? Are there any doctors that you could go to and get any sort of answers for heart health? Has anybody been to a cardiologist and asked them, like, how do I prevent heart disease? Anybody? One? Didn't you go do a test? A little bit? Yeah. What do they say? Because I was one of those guys too. What did they say? Do you remember anything they said for exercise? Eat better, exercise.
Yeah.
Did you leave there with any sort of tangible, like, this is the great strategy, doc, thank you for the specifics? Or was it more, you should just move and you should eat better?
Pretty much that.
Yeah, and so I went in, I was doing Orange Theory, and I was having a high heart rate working out. And I had that chronically for a while, and I was like, there shouldn't be a reason that I'm jogging and my heart rate is just pounding, and I don't have any symptoms, and I don't go to the doctor, I don't take any medications, I have nothing. So a friend of a friend said, go to my cardiologist and kind of see. I walked in, and he's like, what are you doing here? I didn't have a referral, I didn't have anything that he could give me medications for. I was requesting tests to say, I'd love to never see you, like, I'd like to see you on purpose and not as an accident, right? And what was frustrating is he kind of looked at me like, you are not the typical person that walks in, and he had no clue what to do with me. And it was frustrating because I thought, right now, the leading killer in the United States, or the second leading killer in the United States is what? Heart. What's the leading killer in the US? So there's something that ranks higher than heart disease. It's not a disease process.
Obesity.
Obesity factors into heart disease, that's good. And it kind of contributes to a lot of things, but it's not that.
And it deals with
And you won't hear about it. It's not a disease, so you're on the right track.
Medical malpractice?
Medicine. The leading killer in the United States right now is drugs and surgery. Now think about that. When you get sick or you want answers, where do you turn to? Where do we go?
the doctor.
We go to the doctor. So we walk into the leading killer in the United States right now. Nobody talks about it. Now, does that mean they're bad people? Am I here saying, like, never go to a doctor, don't go get checked out? No. What you guys have to understand is the tools that they're working with right now are what? What are the tools that they have and why they only give exercise a little more and eat better? What are their general tools?
Medicine.
Drugs?
Yeah.
Or
Surgery.
cut it out, right? So if I'm a guy in there and I'm like, hey, I work out, I don't have symptoms, I just never want to have a heart attack, a stroke, an arrhythmia, a murmur. You're a specialist, you're an expert. What do? And I get no answer, no results, and then know that, all right, I never want to end up in the system. I don't want my patients to end up in the system, so we need to do stuff like this. So we're committing to these things why we invited you guys as patients to come for staff, because we need to understand what are things to avoid the hospital, avoid the cardiologist, and get to simplified root causes. For those of you that don't know me, I'm the founder of Columbia Family Chiropractic, the 7th coolest doctor you know behind all the other doctors that work here, and we host a podcast. Housekeeping stuff first. If you're a patient, you should have got a half sheet that has little barcodes on it. So that I don't forget this, I want to make sure you know about it. This month, we're focusing on heart health, obviously, and we're doing a heart walk. So you can sign up for the heart walk by scanning this. We'd love for you guys to come walk with us. It's as simple as scan your code, do a sign up. It may ask you for a donation. You can put $0. Just come walk. It's free. It's March 29th. The other things that I want you guys to be aware of is that we now partnered with Designs for Health supplements. So instead of stocking everything like we used to in clinic, now Dr. Allison can do consults and send you specific protocols via our website, which is really cool. I picked out a couple bundles, so if you wanted to check out what they offer, they lay it out where you're like, what is all the stuff you just said, Dr. Tom? It's as simple as scan this and go, if I have high blood pressure, these are the supplements recommended and the protocols that go with that. If you get lost at all, tell one of our team and we'll set you guys up for a more specific consult. But it'll look something like this. Goals for today, I'm going to hit on the 3 biggest causes of heart disease. If I start talking fast, because there's a ton in here that I want to get through, I want to make sure that you guys stop me and say, let's slow this down and unpack it, and we won't get through everything, that's okay. But I want to talk about the 3 biggest causes of dis-ease, which leads to the named disease, heart disease and anything that fits in that category, give you some simple solutions. Then I want to get you thinking differently, and I want to create people that ask questions. You shouldn't go to your doctor and not be able to ask questions. Is that fair? Like when I went, it was to specifically get expert advice about the heart because that's what he studies. I don't study the heart. And what made me fall in love with chiropractic is just basing my life on principles and things that I know are true. Things that I know that 10 years ago, 15 years ago when I was teaching this and I watched my 26-year-old version of this, and it was bad. Hopefully today's is better, but none of the things changed, which shows me that what we were teaching 15 years ago is the same principles of things that we do now to keep people healthy and well. And so that's what we're going to hit on today. Eye-opener stats. Don't want to spend a ton of time on this, but right now heart disease kills 2 times as many women as cancer. Most women are hear about breast cancers and you get scared about going and getting your exams and checkups. There's not a lot of talk about this. And when you dive deeper into why it's killing so many women, one of the things that I found out working with the AHA was we're not doing CPR on women at all, almost. So the likelihood of, if there's a cardiac event and a woman is having it, people are shying away from actually performing anything because you have to compress the chest, you're supposed to expose the chest, and so they're just not intervening and trying to save lives. But there's more to that we're gonna go through. The cost over $500,000 lifetime. 25% of children 5 and up already have plaquing in the arteries, and then 60% of 15 to 19-year-olds have plaque buildup in the coronary artery, which is the big boy that runs back into the heart and feeds the heart. So when you think about that, where is that coming from? In your guys' opinion, when you look at our kids, you used to think heart disease was like, yeah, when you get older, you're just kind of destined for one of these things, right? Where is it coming from in kids? What do you guys think why would kids have plaquing in their arteries already? Diet, right? There are simple things, right? Are they exercising more these days or back in the 60s, 70s? Less, right? We're stuck, we're stagnant, we're stiff. So we have to, again, start teaching but leading by example because our kids are looking at us and start changing it. And I'm going to go through very, very simple strategies. 121 million people have heart disease, 48% adults. If you flip a coin, you meet an adult outside, flip a coin, it's 50% that they have it or not. And every 30 seconds, somebody's dying in our country because of something that research and lifestyle choice change. 95 to 98% of these people don't have to deal with heart disease, let alone die from it. What are you hearing when you hear that? What are you hearing me saying? 95 to 98% of people don't have to deal with heart disease. What that tells you is that responsibility falls on us and our lifestyle choices, not the 2 to 5% that there are genetic deficits, right? So we'll hit on the gene component of this and make sure that you really know when do you go to the hospital. So if I were to have a blood pressure spike right now, pass out, what would I want you guys to do? Adjust me or call the ambulance?
Call the ambulance.
The ambulance, right? So the point of medicine, what my wife is great at and the medical community is great at, is in the US, if you have a crisis, this is the country to have it in. Because we're awesome at life-saving drugs and surgery. When I wake up from that, right? So the incident's over, you saved my life with a medication. What would I want to know?
What caused it?
What caused it? Doc, when do I get off of the pills? Do you think many people get that? They don't necessarily pass out. It doesn't get crazy where they're like life saved medicine. It's normally I go in for a checkup, I get put on something, and I'm put on this medication for how long?
Life.
For life. Because we're not asking questions. And patients now are waking up and being more empowered with everything that's happened in the last couple of years to just question your doctor. Find out where the BS lies and find out how they're living. Take advice from people that are, if you don't want drugs and you don't want surgery, I've never met anybody who's like, can't wait, more drugs, can't wait to cut more parts out, then we need to talk to people that aren't getting parts cut out and aren't on any medications, right? So we have to look at that stuff and understand that the place for drugs and surgery: crisis, hit by a car, bleeding, blood and guts, medicine. Health, they suck at. Prevention, they suck at, right? So principles, basic principles to look at, and we just have to be on the same page of this so that you know what I'm going to teach from is stuff that, like, I don't need a research book. I don't need a textbook on. I want you just to, like, let it marinate inside your body and go, okay, this just feels right. The body is smarter than all doctors. Is that fair? Can we all agree on that? Yep. There's an innate intelligence inside of you that you came from 2 cells, and in 9 months, you are this living, breathing, know how to crap, eat, heartbeat, lungs breathe, all the stuff that nobody taught you, right? Innate, inborn intelligence. Fair? Mm-hmm. So the best cardiologist is where? Yeah, see, if you guys read, this is like I'm like, oh. So knowing that it's inside of you guys, I could pull the 1,000 smartest cardiologists in the world, and they have no freaking clue what your heart needs right now. What does? What is the most important thing that you have that runs and regulates every cell, every tissue, every organ in your body?
Nervous system.
Yeah, your brain, right? So we know that we can literally take your heart out these days, plug in a brand new heart inside of you, and if there's issues with your brain talking to that heart, it doesn't matter how good the heart is, right? It doesn't matter how good the surgeon was. It doesn't matter the medication that you're on, because it's that innate inborn intelligence that is designed for health and healing. So we know that God set us up for health. We also know, and you have to think about and agree, that symptoms are the body doing what? The right thing or the wrong thing? The right thing, which is a philosophical shift that most people struggle to or I shouldn't say, it just takes time for you to really grasp it. If you can really grasp where you wake up and you go, man, I have a headache, and instead of thinking, I need a pill, you think, what caused that? That changes your life. That drastic, anything that happens, your foot hurts, your chest is pounding, you have high blood pressure, you have low blood pressure, you have an arrhythmia. If you can just go, what's causing that, instead of what do we do to treat that? Game changer. What's our medical system based on, though? It's treating, right? 100 years ago, the cutting edge medicine was lobotomies and bloodletting, right? Which if we look back and we go, man, how could people let you drill a hole in your skull or just bleed you out? Wouldn't you guys think those people are a little crazy? That was the cutting edge medicine of the time, right? We now have the time and distance to go, that's dumb. What are we doing right now that 100 years from now, they're going to look at us and go, can you believe they were blank? Right? Why is that, though? It's because God built your body. Man's trying to figure it out. It's never going to catch up. Science is great. I'm all for it. If it matches up with God's plan, nature's plan, God's design. If it doesn't, we're chasing and things are changing. Science is changing constantly. Vioxx was a cutting edge painkiller. Do you guys remember Vioxx? Those of you that are older like me? It killed 65,000 people before it came off the market. Megan, you know that? Okay, good. It took 65,000 deaths. You didn't? Good. It took 65,000 deaths before they pulled that off the market. Now, again, it went through studies. It passed all this stuff. Everybody says follow the science, trust it. Well, when it came out, everything looked good on paper, yet how does it kill all those people and then we pull it off the market? Are there drugs right now that we're doing? Are there vaccines that we're doing right now that 5 years, a year, 10 years later, you'll be watching TV and see a commercial that says, if you took blank, and you see it all the time, but we're still just waiting for sickness and disease to then try to treat it with the next thing, bloodletting, lobotomies, vaccines, high blood pressure pills. It's just chemotherapy. When you really step back and go, what the hell are we doing? What are we doing with using poisons to try to get somebody well? That's a philosophical shift that I need you guys to make. Health is when the body's healing and function 100%. You guys have seen me and talked or heard me talk about that enough. Disease is dis-ease, which we're going to mention that it's the absence of health. There's no real thing. We've named common patterns, right? So we've named common patterns of response, like a group of symptoms we can give a fancy Latin name to. Does that name matter? What happens is we hold on to it. I have high blood pressure. I am diabetic. We start building this disease world instead of thinking like, what created that? Who really am I? And is my body designed to heal that? Are there simple rules that we can all agree upon that get us well? Like you don't need science that says like move your body. Is that fair? Yeah. Sleep. Is anybody going to argue that we shouldn't sleep anymore? Is anybody going to say we don't need water? How about just food that God created, right? Sometimes food can get complex with what we're doing, but if nature or God made it, it's a good starting point. How about minimizing toxins? Is that fair? So all stuff that if we're doing this right now, and we're looking at this scale, and we're looking at if we start breaking those rules, if we're not sleeping enough, are we heading closer to life and health or away from? Away. If we're not drinking enough water, closer or away from? Away. But when we hit this threshold, so the beautiful people, the young people in here that are the feel great, everything looks good, my doctor's going to save my life, and I'm feeling good, this zone right here is the scariest because where does heart disease, cancer, and diabetes build? It feels fine for years, right? If you knew there was something going on, you would try to do something about it. But you guys know somebody that dropped out of a heart attack out of nowhere. I would imagine somebody in your family, someone close to you. How about a stroke that happened out of nowhere? How about felt great, looks good, runs, eats organic, does everything right, went in for a test, has cancer? Heard of that before? Mm-hmm. So what are we missing? We're missing this silent slide backwards that we all know right now we're breaking rules, me included. Could I exercise more? Could I eat better? Yet we still struggle with waiting for the symptom, waiting for medicine to just cover it up and never address the actual causes. Start with where you're at. People will want my advice a lot on just like, hey, I have a thyroid issue. I have a high blood pressure. Hey, doesn't matter. Fill in the blank. The simple is, all right, how's your rest? Like, what's your sleep pattern looking like, right? Am I going to give you a specific herb and an exercise? Like, if you just start like not sleeping, can we start there, right? Water intake. Just simple, basic stuff. So when you hit this threshold, obviously this is a problem. You're dead. You're not around. But when you deal with this, it's mostly just dealing with it from this perspective instead of saying, what do we do to move that direction? My uncle had a 98% blocked artery, no symptoms, and again, he ends up going in, getting surgery. It fixes the blockage, but did they ever address what caused the actual creation of why did it get that closed, right? And so we want to, again, continue to address those. So the causes of disease are breaking the very rules that we all know about. How we eat, exercise, sleep, water, and exposure to toxins. If we just look at those, and really mindset, how we think about disease, symptoms, and just stress, and how we manage all of that stuff and deal with it. So here's the three things. If you're a writer-downer person, write these three things down. Thoughts, toxins, and traumas. It's a little clever way that in the chiropractic world we remember these. The 3 T's. So we're going to hit on thoughts. Your perception and beliefs equal stress. When you think about stress, I built up personally a pretty good tolerance to stress. There are a lot of things that happen in life that just like don't move the needle anymore for me. Whereas there are certain things that move the needle a lot for people or for me. Like if you let a tiger into this room right now, what's going to happen to my blood pressure? It's going to shoot up. What's going to happen to my heart rate? And hopefully everybody's, right? That's one of those that everybody gets stressed. That's a short-term stress response. Makes sense. My genes didn't change. Your genes didn't change. My diet, nothing changed. Just that moment, that perception. The tiger didn't touch us. We just saw it. We went, oh shit, I'm in trouble, right? So that's where we want to make sure we're really controlling our thoughts. The first thought we can't handle, like it's real. Something bad just happened. Tiger in here. Couldn't change that. How I react or respond, I can choose to deal with, right? And that's what you want to look at in your life is what are the things that you just start feeling that increase in blood pressure. You start feeling that increase in heart rate just from what you're thinking about. Worry, anxiety, toxins. We're going to hit on inflammation. That's the biggest thing. So I'm going to spend some time going through on the whiteboard. Then honestly, when I hit the whiteboard stuff, if you understand that, and I'll try to go as slow as possible on it, it will explain 50 plus diseases just on this simple, if you manage and decrease inflammation and focus on that one thing, this is where your chances of heart diseases, cancers decreases significantly. And then trauma, subluxation, I'm always going to talk about that. Minor and major traumas. Minor in the fact that like when we sit and we do this all day, or we do this, if we sleep weird, or we carry bags, minor traumas. Hit by a car, play sports, injuries, major traumas are going to move the body, create interference. So we're going to hit on all these. Those are the three. So cause one, I want to just do something with you guys. So as I mentioned, if we put in things that you're afraid of, it changes physiology. So we know right away that it's not anything to do with diet, exercise, anything physically. I just need to make sure that I can sit in a room and I can tolerate or look at things from a different perspective. So this morning, and I was going to use a different example, but I'll use both. If somebody cuts you off when you're driving and you're one of those road rage kind of people, what happens to you? Like, what do? Yeah, you get, like, your body starts to change, right? And you start, so you couldn't help that they did that. But your reaction to that, you have control over. So what I found is if you shift the story in that, like if you go, that person had diarrhea and just shit themselves and has trying to get quickly to clean themselves up, you relax. You go, okay, he needed that, she needed that. This morning, I pull up, guy parks like right next to me, okay? He's upset that like he pulled in, I can't get out of my car. Now I can get really pissed off, or I can just go like, you should make up whatever story you want. His wife got upset with him and threw, water in his face today, and he's just said, so just change the story. It doesn't matter what is happening, it's the reaction and response later, because your autonomic nervous system looks at those same events like the tiger. What it's doing is it's taking your blood and saying, let's get everything out to your extremities, because you either have to fight the tiger or you have to run, right? So even though I had no interaction, fist fight, nothing, my body interpreted that as I have to change. So what are things that you can do? What are takeaways? One, change your posture right away. So if you get into certain postures where you're angry, anger is crunched and curled, you can just open everything up. Breathing, an easy technique for autonomic nervous system, which is the nervous system that's like your up or down button, is a double inhale with your nose. So everybody taking a deep breath with their nose, and then another deep breath in their nose at the same time. And now just blow it out slow. You do that 3 to 10 times, it resets and puts you from sympathetic, fight or flight, to rest and digest. So it's a very quick and it just, do you guys feel a little bit better with that? I mean, I do. So does that work for you? And what it's signaling to your brain though, it's signaling to your brain, let's bring the blood back into the organs, let's rest, let's digest. That's kind of how you have to really look at when you're getting irritated. I'm big on the I am statements. A lot of people say I am and just negative shit about themselves. You guys that know me and you guys that give me crap for it, I'm generally very positive about myself because working on others. But here's why. I don't love hearing, I don't want, even if it's BS, right? Even if it's something that I don't believe about myself, why would I say something negative about myself, right? Because what happens is my body starts to search for the I am blank, right? I am overweight. I am never gonna exercise. I am a terrible sleeper, right? All of that stuff, does any of that sit well? So I want you to do something just to show how your brain works. Look around the room and look at all the red stuff in the room. I want you to look at all the red stuff in the room. Okay? Close your eyes. Everybody close their eyes. I can see you that you're not closing your eyes. All right. Tell me what was yellow.
Jenny's drink.
Top of Jenny's drink, nice.
Inside.
You see how, so here's the point. When you focus on, if I said what's red, you guys would have named off 15 things, right? There's red everywhere. And there's yellow stuff around, my shirt, her shirt, the top of that, the bag. But because your brain wasn't looking for that, it's the reticular activation system. It is your Google search engine in your body that you guys have experienced this, whether you know it or not. Like you decide you're gonna wanna buy a car, and you decide on the make and the model and the color, and guess what you start seeing everywhere? That car dealerships, ads. Did they just show up, or were they there and you just started programming, right? I think a lot of my life I just programmed artificially, and it just happens because I don't give myself a lot of negative anything, like never. And if you get trapped in that, just switch it. The beautiful part is the subconscious doesn't know right from wrong. What you tell it just is. It's like searching. It doesn't know. So it doesn't know if you're bad at running or you aren't a morning person. So the I am phrase, easy thing that you can change. We talked about the change your story and how stress is going to elevate that fight or flight, and how cortisol is a hormone that stores fat. So the real reason that stress is worrisome is it starts storing fat. People that are chronically stressed, they're chronically inflamed, and they're chronically overweight, and it's all because of just stuff they're thinking, like the worry and all that stuff. Just start thinking a little bit differently, changing your thoughts. 3 myths that I want to help open up your eyes and start changing brain stuff now. So along this, here's some of the action items in brain stuff. My doctors will alert me of problems and give me steps to correct. My GP is responsible for my health and will keep me healthy. Is anybody relying on their family doctor, or even us? Like you guys that are patients, you should not put your health responsibility on us. We're here to guide, teach, remove interference. Do this. The only thing that can heal you is already inside of you. We remove interference to that. We assist in the journey, but we're not your savior. Whose responsibility is your health?
No.
Yours, period. Not the government, not your doctor, not insurance, none of that. Yours. We challenged our staff, and I challenge you guys, really look at your budget and look at where is your money going. Outside of shelter, all right, I gotta live somewhere, the highest ticket item on your little spreadsheet of where your money goes should be where else? Columbia Family Chiropractic. No, should be health. Anything in the health category. Why? Like your food fits into the health category. That's a choice, right? Your gym membership, health category. You should be able to add that up and go, there's nothing higher than that. Why? If you're sick, what can you do? Can you go to work? Can you hang out with your grandkids? You can't do anything. So it is that priority that has to jump to the top, and it is your responsibility, and you need to look for teachers that help you. How many of those people that we talked about ever get off medications? Rare if never. I had a patient named Evelyn, awesome lady. She was 65 when I first met her, turned into like my local grandma. And high blood pressure, neck pain, standard deal. Went to her doctor put her on blood pressure medications. When we started working on her, adjusting her, changing lifestyle stuff, what do you think happened to her blood pressure? It started lowering. Is that because we have a magic blood pressure adjustment, magic food, or was her body just not dealing with the interference, making the right changes, and moving towards health, 100% function, moving that direction? So she started changing, moving that direction, blood pressure normalizes. Now, every time she takes a medication, a blood pressure pill, what do you think happened to her?
Her blood pressure drops.
Lower than it's supposed to. Mm-hmm. You know when they took her off of medication? In the ER after she passed out because nobody wanted to get her off the drugs. So even in the conversations, guys, where when you guys start as patients and a team and you start making these health changes, understand your body's functioning differently than you were yesterday. And every adjustment, every movement, every stretch, every bit of nutrition, supplements, you are increasing, moving towards 100, and the chemicals they're putting in that were forcing the blood pressure down or cholesterol or whatever you're on medications for, know that you need to have strong conversations with your doctor to come off of that. Your body is doing what it's supposed to, bring you to homeostasis, and you are taking a pill that's forcing it down. She blacked out, rushed to the ER, cost her $2,000 for them to tell her, oh, your blood pressure was too low because of the pills we gave you. Insane. Wrong. Edit that out. Medical tests find disease when it's too late. I hate the phrase, early detection is the best.
Prevention.
We all know it, but when you detect something, you didn't prevent it. It's freaking there. Like, that blows my mind, right? A lot of testing they're doing is pathological testing. Give you an example. Vitamin D, the range for vitamin D normal is 30 to 100, right? Pathologically, if you're below this number, right, they flag it. And even in the medical space, like, you know vitamin D is serious because medical doctors are telling you to take it nowadays, right? We've been telling people for 2 decades, here's the range. This is pathological if it's outside of these. So if you're at 31, you are normal range. The problem is, you know what the functional range is for vitamin D? It's somewhere in the 60 to 70 to 100 range. So if you show up with a 31, you get your numbers back and you go, great. Doc, yeah, nothing's marked. Vitamin D numbers right in range. You're pathological, or not pathologically, you're functionally deficient in vitamin D, and they will wait until you're, again, months, if not years later, they retest you and you go, oh, you've got chronic pain, arthritis, heart disease, cancer. We need to start giving you some vitamin D. It's super low, right? Wrong testing. We need to look at right testing. There's a slide I'm going to show you guys that I want you to take a picture of what tests we recommend. That's on the next thing over here. So I like the functional testing because it tells us if you're in the functional range, yes, Ron and Ruth front row. Back to 2012, right?
Yes.
A long
And
time.
so if it's in the if it's outside the functional range, that's when we should start responding, reacting, doing something about it. Not, let's wait until it dips to the pathological, and then now we're so far behind. And that's just one example. Every bit of your blood work is based on ranges that aren't necessarily what they need to be functionally. So functional medical doctors and functional practitioners are the new chiropractors, if you will, because we've been talking about this forever on just making sure that you're putting stuff in your body that will increase function. And it's becoming very popular, so we always recommend going to them. They keep moving the goalposts. Normal cholesterol, I think 15 years ago maybe, was 280. What is it now? 200. Yeah. So if they move it 180,
they are lowering it.
They continue to lower it and lower it. So when they take it from 200 to 280 to 180, what did they just do? Did they find out new information that means you need to be at that 180 range?
They up more people to take medicine.
They just open up a population of people that can start putting on medication by doing nothing differently. And when you dive into the statistics and you look at cholesterol, that's one of the more BS kind of medications that's out there. They love this. You guys see the new pre stuff? Like, you go into CVS, you have pre-hypertension, pre-diabetes. What does that mean? You don't have it. Isn't pre before? Like, you don't have hypertension. So I'm I'm pre all this stuff, right? They want you to have some sort of name that's saying this is your destiny, programming you in, you're gonna get it, it's inevitable, let's start treating you now when you're healthy, you're normal, right? It's nuts. And a lot of the terminology in these stores is like heart disease management, diabetes management. I don't wanna manage them, I wanna get rid of them, right? I don't wanna manage my whole life these medications. They start over-treating. I talked about Evelyn, because the over-treatment comes from bad testing, meaning right now I'm revved up. If you took my blood pressure, it's gonna be elevated, right? And if I walked into a doctor's office and it's elevated, they would recommend what? Do you think your blood pressure just stays the same all day? Like, forget about me getting revved up. I'm talking like you walk from your car to here. Is that gonna move it a little bit?
Yes.
Yeah. How about just your hormones and women when you're on your cycle? Think about your blood pressures doing this all day. Now again, I can't legally tell you this, so I'm not. I'm gonna tell you what I would do, is this. Blood pressure is one of those things that you buy a cuff, you take data of yourself, okay? 3 to 5 times a day, I want you guys just write, if you have high blood pressure, so if you have high blood pressure, write it down. Morning, this is what it was. Mid-morning, afternoon. So then you're gonna see you on a real picture of you. You can test this stuff at home. And then, if you're on a medication, don't change anything, but now you have data. Okay, here's my numbers, and here's when it changes, and here's what I was doing, and yada yada. The next week, okay, now remember, this is me, not you doing this. You should talk to your doctor that put you on the medication. I cut the pill in half, or the dose, or the whatever. And guess what I would continue to do then for that week? Write it down. Guys, if it spikes, then you go, okay, I better get back on the medication. What if it stays normal? What you're gonna do is you're gonna be an advocate for yourself. It's your body, you get to choose, and you can start the process of weaning because you have the data. There's no fancy test anymore where you had to go to a nurse, they pump your arm. You can go to CVS, you buy one of those little cuffs, and you can watch, right? So I'm not saying high blood pressure is good and like live with it off of medications. I'm saying you make changes and don't be Evelyn. Start moving the needle and know that when you go in for a test, if you're sick, blood pressure and your cholesterol is going to be elevated. If you're in a certain, if you didn't get you had poor sleep, if you're experiencing mold issues, like your body is doing stuff, and the snapshot that they're giving you, terrible. Now, this is the one. Take a photo of this. This comes from this book, which is a medical doctor that wrote it, which basically says the whole thing on cholesterol is BS. It is one of the biggest scams. Well, we've had bigger scams as of recently. But cholesterol is one of those things that, honestly, they can't even find evidence that anybody should be on the drug, period. And it's a bold statement, and I'm willing to do it because there's a lot of data on this and a lot of manipulations of statistics. Here's a fun one for you with cholesterol. I haven't spoke this long in a while. I gotta get vocal. I got the water. It's like the vocal cords are just not used to it. Yeah, I need some. They will ask a question like this: does the pill lower cholesterol? Which, if it does, it passes. Does the pill actually prevent heart disease or death? No. That's not the question they're asking. You see how so then we look at it like, you take the pill, they are doing what it says. It's lowering your cholesterol, but you're taking it because you think it's actually decreasing your risk of heart diseases and heart attack. It doesn't do that. And they're finding more people with lower. So these are the functional tests I recommend, and we'll dive in a little more, but when it comes to cholesterol, it's particle size matters. And then HDL and LDL, I'll have a slide on that and how there's no such thing as good and bad. We're gonna walk through all that stuff. You can see how everything's a little bit different. So actually myth 3 is gonna be cholesterol. So let me touch on genes real quick. I have bad genes, heart disease runs in my family. You guys have heard the old like heart disease runs in your family because you don't run or nobody runs in your family joke? Genes are interesting. There is some good data now about genetics and your processing of nutrients and how your body deals with certain foods and normal stuff. But as far as just genetics and disease, that's been gone since like 95. Yet, we're still in an era of thinking like, oh my God, mom, grandpa, dad, everybody had this, I have that gene. Think of your genes as the light switch, over there on the wall. So it's there, right? It's there, it just has to be turned on. And what turns it on? Who's old enough to remember this little diagram in biology? That's DNA.
Okay.
This is a cell.
Okay.
What is this? What's DNA housed in? What was that called in the cells? I remember. Mitochondria is a little bit, but like, what's the brain of the cell? The nucleus, right? So think about this. We used to be taught back in the day when we walked uphill both ways that the nucleus just controlled our destiny. Whatever your DNA was in there, you just were stuck with. Now we know this is not what controls the expression of genes, which is wild to think about, right? Meaning they're finding like humans across the globe, genetics hasn't changed much in thousands of years. So these little variants we'll talk about, But what actually tells the nucleus to do, like take it from a stem cell and turn it into, say, a heart cell, a skin cell, a liver cell, right? They're just generic cells like the baby, right? Starts to multiply, then it starts to differentiate. Well, what is deciding all of that is actually input from the environment, and you know what the most important part of the cell is?
Membrane.
The membrane. Now, why is that? Maybe like another thing to think about. Like when I walk outside and it's getting hot, so let's just pretend it's summer, it's 100 degrees. My skin is the membrane of my body, let's say. When I walk out there, it's going to perceive what? Heat. Very hot. What's my body now, brain, going to start to do? Sweat. Because so this is reacting to environment. Now your cellular, like your internal environment, you have cells floating around, and I'm going to show you a couple things on this input is the most important input that you have. So again, if you're drinking soda, if you have seed oils, you have bad cell membranes, right? You know what the cell membrane's made of? Fat, lipid bilayer, right? The number one nutrient deficiency in the US, probably in the world, is healthy fat. We get a lot of fat, just bad, rancid, trans, bad, whatever, who cares? And it starts to do this. So now you're getting the signal of like, it's hot out, and what if this goes, I don't recognize that. My body never starts cooling down. What happens? It has options. It dies, right, because it overheats, or it starts to adapt to that temperature. And it starts changing everything about my body to tolerate 120 degrees if it can, right? So this is important. That's an important analogy to think about in all your cells. What those cells are hearing is more important than the DNA and genetic stuff that's inside. The stuff are just parts, right? Blueprints. They are literally maps to say, do you want to build this house or this house or this house? Do you want to add windows? That's all genetics is. Dr. Bruce Lipton, an amazing book from years ago, talks all about that stuff. The hottest field is epigenetics. They're studying this more, which is now knowing that here's your DNA, but knowing that we can turn on and off those via diet, exercise, lifestyle. Chiropractic, which is wild. Adjustments change DNA. Crazy stuff, right? So understand it, but we want to look at these little genomic variants are what's important. So what I mean by that is, like, say you do have a genetic change, they call them SNPs, which means a little reference point in your DNA, when it goes to fire normally, it may now not have the pathway to, say, break down vitamin B12 very well, or alcohol very well, or it can't convert to a usable form of this fat to this fat, right? That's important because on paper, you could be taking, say, vitamin D, and you now have a genetic disposition that doesn't convert that. So what is the vitamin D that you're taking if you have that genetic variant? It's a toxin. Meaning it doesn't know what to do. It's looking at it like, I should know this. It's real. It's natural. God created this, and I can't do anything with it, right? So those things in your genes are cool to look at. Like, that is a cool thing to look at. Don't get too in the weeds on genes until you just are doing the basics. Sleep, water, remove interference in your nervous system, eat, right? Another quick one on blueprints. I love this because I'm going to solve a lot of disease problems today for you guys. The question is, are you going to take action? So 3 cells. Normal's the middle. This is a diabetic cell. This is a cancer cell. It's exactly what I just told you. So you have the normal cell that has, bad color. You have the normal cell that just has regular receptors. So think of these are the things that are the gates or the garage doors, as I have here, that allow things from your blood, so food and nutrients and every oxygen, to come into the cell. These things have to open and close, right? Just like a garage door. A diabetic cell, the adaptation that occurs is we dump so much sugar in our body, in our bloodstream, that it's floating in your blood and trying to get out of this blood vessel and find a garage door to park it in. that we do it so much that these garage doors start breaking down. So type 2 diabetes is literally not an insulin issue. It is a high sugar adaptation of the cell or breakdown of the cell so that it can't park in there. So guess where the blood sugar has to stay? In the blood vessel. You go into your doctor, you have elevated blood sugar because it has nowhere to go. But it's because the analogy we give is like a screaming child and a mother. Everybody hears a screaming child, but the mother's already tuned the child out. It's like, hey, like that. You've been screaming sugar, 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 sugar. Garage doors aren't open. Okay, so that's one adaptation or breakdown from normal. The other is like I mentioned with the going outside. This cell could go, if you're dumping sugar in our body constantly, then I can do another thing, which is create a hell of a lot more garage doors, receptors. When it does that, that's a cancer cell. Cancer cell is 8 times the receptors than a normal cell for sugar. So when they test like a PET scan for cancer, they attach a glucose molecule onto a radioactive substance. You drink that, then they scan you and they find out where is it uptaking the fastest. Meaning where's the glucose going and what's it feeding the fastest? Oh, cancer's right there. So if we test it that way, why are we eating it? Like think of like for cancer diets and just disease diets at all, why are we eating this stuff? If we know that every time we eat sugar, it's going to feed that first, do you see the problem? So the genes are going to just express, it goes from normal to go, environment's a ton of sugar, I'm going to do this, I'm just going to be more receptive to it, it's abnormal, it's now replicating and it becomes a tumor out of control, or it doesn't adapt, it breaks down, it's diabetic, and you're both models, you can see how disease starts to form, and it's all a receptor issue. So what do you do? What do you do in this scenario?
Cut out the sugar.
Sounds smart to me, right? That's step one, the easiest. The other thing that has to happen that doesn't get talked about is, what was the cell membrane made out of? Healthy fat. We have to eat fat. You have to get your fat ratios. You have to get a lot of healthy fat in your body. They're considered essential fatty acids. What that means is we can't make them. We have to eat them. So if you're not eating them, we're not making them, right? There's essential amino acids in the protein world. If you're not eating them, you're not making them. What are the parts? What are the parts that we're trying to build these cells out of? The stuff that we're eating, right? So a simple diet shift that I had was like, man, if I had to take a picture of my food and like make my heart out of what I'm eating, do I want this to turn into my heart cells? Like, and that's a good like on the spot, oh man, this greasy cheeseburger and fries, do I want that being the parts for my heart or liver? Or that's an easy like quick shift for you there. Any questions on genetics? Does that make sense? So the takeaway, don't worry about them. Do something about your lifestyle that changes your environment, and that will only trigger the good genes so that your body actually moves the right direction. Okay, high cholesterol causes heart disease. It's not the high cholesterol, it's the oxidation of it. So we'll talk a little bit more about that. That's like free radicals that are floating around that inflame it. More people have heart attacks with normal cholesterol than elevated, which most people don't know. There is a higher death rate with lower cholesterol than high. Most countries, Spain, England, have much higher cholesterol in their diets and high cholesterol in their bloodstreams, and less heart disease, less heart attack, and less death mortality. Statin drugs, cholesterol-lowering drugs, lower cholesterol but not the mortality of heart attacks and stroke. So as I already mentioned, Big Pharma just asks smart questions. So they get by, they're not telling you the wrong thing. It does lower cholesterol, it's just not solving what you think it is. We've attached the drug to actually getting rid of heart disease and risk of death, but that's not what it is. It's just lowering cholesterol, and you deal with the other issues with that. So what cholesterol really is, it's a repair substance. So I think of this as a very simple thing. It is a thing that comes in when we screw up. The brain says, liver, produce cholesterol. If your body's producing a substance, and a lot of it, don't you think it's probably good for you?
Yes.
So your liver produces a lot of cholesterol. What's cholesterol? What are things that cholesterol make? So we know it patches arteries, which is a good thing, understand. But what else does it, what is it a part of?
Also your brain.
Brain. Your brain's 60% cholesterol. Your nervous system. What's the most important system we have? When you take a statin, do you think it's just going into your artery and going, hey, here's the bad stuff that we need to like clean up? Or is it peeling layers from your brain, your nervous system, your spinal cord? You see the danger? Do you see why the side effects are just effects that they don't want? But that's Alzheimer's, dementia, because you're just stealing enough years of taking away layers and layers off of your brain. Cholesterol is needed to manufacture hormones, bile, vitamin D. So sex hormones, the primary thing for you to have estrogen, progesterone, testosterone is cholesterol. When they put you on a medication, a cholesterol lowering drug, guess what you start seeing your hormones doing? Going nuts. And so therefore, then they start treating? It's never linked. Like, this is what's wild. So what changed? Oh, I just started taking this pill. Your hormones are off, so let's treat this. Instead of like, maybe we should come off of this. It's a muscle weakener. The ones that they call good are HDL. Think of those as like those are the small guys that come in and kind of clean things up. So I think of them like moving away from the heart, cleaning and kind of scrubbing. The LDL are the ones that are coming in and actually patching. But here's the issue. Why that picture, the tests are important? Who we got beeping? I think it might be your phone. Or alarm.
The watch.
Maybe I'm just hearing it. I think it's in here. Oh. Okay. So particle size is one of the tests. So large particle, actually the ones like LDL large particle actually produce hormones. So like they're good. So if you get a just flat test at your doctor and it says LDL is elevated, the bad guys, what if it's upregulating because you need more hormone production, right? So if you look at particle size and you go, oh, it's high, but it's the good stuff producing hormones, don't touch it. If it's the small guys, LDL, those are the ones that are more of risk to be a problem, but they're still not the problem and they're not bad. They're doing their job. They're doing exactly what they're supposed to.
Can they test for particle size?
Yes, yes. And that's what's frustrating. So the tests you guys get, they don't. If you go to a functional doctor, ask for this, look for the different ratios. That's why that slide from that book is just like, that should be the standard test. Why are we not doing that? They base it like, measure your blood pressure, you're on a pill. Like just from yeah. And then get your blood work, LDL's elevated, they look at a couple things, but it's just a gross look at it, not a like net what's happening here. Like and again, if you were sick, if you have a mold toxicity, if you have a bacterial issue and your cholesterol is elevated to deal with some of that, it's not a heart issue, it's dealing with something else. So I'm a big proponent of retesting, really look at this stuff and look at the functional things. Dangers, as I mentioned, it's 60%, your brain's 60%. And then this is a big one. If you're on a cholesterol medication, right now you need to take CoQ10. Mm-hmm. If they haven't told you that is malpractice in my opinion, because it depletes CoQ10, which is a big one that protects your heart from oxidative damage.
I asked my cardiologist about that because my doctor said you need to be taking it.
Yeah.
And my son's doctor, has him on the cholesterol and did not say anything about the Q10.
Yeah.
But my doctor said, well, they tested it and they haven't really determined that you really need it. And I was like, oh, really? So,
why are they so hesitant? See, this is what I don't understand. Yeah. They're so hesitant about natural stuff. Like if you guys are like, hey, I'm taking a vitamin C and vitamin B and a Malta, they're like, whoa. You probably don't need all that stuff. And then it's like chemical, side effects. You're going to die. It's like, yep, this is fine. Don't worry about that. Can't be that. It's wild to me that they like steer people away from vitamin. The worst thing a whole food vitamin, like a real vitamin can do is go out your body via feces or urine, right? Or sweat. Because your body goes, I know what this is. Do I need it? Nope. Okay, go on. Like food. Do I need it? Nope, go on. Chemicals, the problem with the pills is like, goes in, it's like, what do I do? Store in fat. Liver, try to figure it out. Kidneys, can't get rid of it. Bucket starts to fill. Toxin. And now all of a sudden, more symptoms, more medications. You can't get well.
So the CoQ10 takes care of a lot of that?
If you're on a statin, you need a CoQ10 because it's depleting you. So just the drug itself wipes out CoQ10. So at bare minimum, take that. I'm a proponent of like, get the functional test, look at the particle size, and probably get your doctor to take you off of statins ASAP. Challenge is finding a doctor that will do that. Now, and let's talk about why. Why do you think when I say some of this stuff, why do you think, like, it comes off as like anti-doctor, anti-medicine? It's not. It's just that the guidelines like that Megan and doctors and they have to deal with are like if you went to 9 out of 10 doctors and had high blood pressure, they have to recommend what? To save their license.
Oh.
Right? If they don't offer you a medication and something happens to you, they look at, well, what would the other 9 out of 10 docs do? You didn't offer a medication and your patient died, you're liable, the doc. So do you see how the system is the problem? They want, a lot of them are like, Dr. Taylor's adjustment lowers blood pressure by more than 2 medications. There's data on that. They'd love to send it to Dr. Taylor and do that, but they can't. If they do, it's kind of like I'm doing, a little sneaky, we're on film, but tell you some things and like, maybe you should go over here. They don't care. I mean, not to say they don't care, it's just a mill. It's like we get paid for giving you drugs, staying in our guidelines, and unless the guidelines change, you guys are stuck. That's why we do these talks. Like as I mentioned, there's not a cardiologist doing this. I don't have the business, like I'm not an expert in heart, but I love health and logic. And if I can empower you guys to be the experts for your body and just the advocates to say like, this doesn't add up. The data's there. You're just not seeing it because it hurts their cause.
Corporate
Quick question.
guidelines also. Corporate guidelines.
Yeah.
I was going
It's
to
a hot-
Lexington and I was like, he wouldn't do certain things and I knew it was because
Yes.
Lexington was saying, we will not offer this.
Right. It's a business. I mean, that's what's weird about the hospitals. You got to understand, like, they have, like, hey, we need to do these codes to make this dollar, and you guys are the people that aren't necessarily paying it directly, but it's filling their pockets.
Does the strength of the CoQ10 matter?
Yeah, that's why quality matters. I'd have to look up the dosage. So what's nice is if you scan the cholesterol bundle, it's the one that's on there is a great one. And there's like 2 others that come with it. So, and think about this. These are natural substances that are going to support you in your journey of coming off medications, right? Or preventing. You know what I mean? So if you're at risk or you're worried, it's like start doing this while you start walking, changing your diet. Like supplements to me are the easiest things. Like put a pill in your mouth and swallow it. Liver damage. So you just got to think where all cholesterol is involved, and these are what I was saying. Like they're not side effects, they're effects. It's just that how much you feel of them, right? Some of them feel really quickly. The best one is the muscle wasting because your heart is what? A muscle. So I just can't wrap my mind around. You take something that's a poison that attacks your heart, and you're going to reduce your risk of heart disease. Never made sense to me. So should I lower my cholesterol? Better question is why. Is it elevating? That's why I always am a why guy. I'm always a cause guy. I want to just know, like, I like you guys asking questions. Why is it elevated? If they give you BS, like, well, you should have a genetic disposition for this. All right, well, what else can I do? Like, is it inflamed? So that's on another test is C-reactive protein, which tells you your inflammation levels. So you may have high cholesterol and low inflammation, no risks. Very low to like no risk. That's why the inflammation number. Now, if you have high cholesterol, high inflammation, high risk. See what I'm saying here? So again, you have to make the changes to decrease your inflammation so that your cholesterol, it'll all go in a teeter-totter here. But again, here's a medical doctor telling it's never been conclusively shown that lowering cholesterol saves lives. And there's been a lot of studies on that stuff. Action items on the thought and reduce stress. As I mentioned, change your story. Use the breathing techniques and change your I am statements, okay? Thoughts done. Promise the other 2 are a little bit quicker because we have 30 minutes. 30 minutes still? Everybody good with 30? Okay. Toxins. Any substance you put in your body, in or on, and I highlighted your because that is unique to you. Understand, as I mentioned, like if I do a food sensitivity test and I can't tolerate celery, like on paper, everybody's like, celery's really good for you. But my body, it might not be. It's a toxin. Does that make sense? So that's why I say your body. There's a lot of nuance in the diet world and why people get frustrated is because your friend did this and lost all this weight or feels great. And it's like, why am I not? You just got to keep digging. There's fine-tuning things on like, well, let's look at your body and find out what's harmful. Toxins create inflammation. Anything ending in itis is inflammation. Arthritis, sinusitis, pancreatitis. So inflammation is, again, they took a simple-ish thing and put fancy Latin words with it, right? Arthritis sounds scarier than joint inflammation, right? Because if I say joint inflammation, you would think to yourself, oh, I should get rid of inflammation, right? If they called arthritis joint inflammation, what would you do? You kind of know the solution by the naming of it. They don't call it that. They call it arthritis because it's scarier and you have no freaking clue what it is, right? Unless you break down the Latin. Sinusitis. Sinus, what?
Inflammation.
So what should you do? Reduce inflammation. We're going to focus a lot on reducing inflammation. The biggest culprit that, as we talked about, is sugar. I used to talk about this in my nutrition class. It's like, would you ever go to a restaurant and order like a bowl of sugar as an appetizer, like right before the meal? Never, but what do you order right before the meal?
More sweet tea.
So you do it, yeah. Sweet tea, sodas. So we don't look at it like an appetizer where we're just spooning sugar in, but look at the amount of sugar in just those little bits there. What is your body doing with that? Your bloodstream is like the most sacred fluid you have in your body. Oh, maybe there's other fluids in there. But it's very protected pH-wise, meaning if you do something to your blood, the brain and body freak out to go, let's normalize this. Like if you're bleeding, normalize, freak out, right? If there's a high, like if you douse it in sugar, acidity just went through the roof, it needs to now figure out how to normalize that. You guys remember chemistry, the acid-base stuff? Okay, that's what the body's doing all day, every day. Is there a doctor that can figure that out in your body? No. Guess what can? I'm going to keep telling you, your brain, your spinal cord, your nervous system is the only doctor that can regulate to the 0.001 decimal of what your body needs in your bloodstream. And it knows, call on this organ to produce this, to affect this, to do this, to change this. And we're relying on a spoonful of medicine. We're like, oh yeah, the doctor that gave me this medicine knows more than my body. We just got to support the body. We got to look at the body. We got to look at causes. So this is the diagram that's going to change your life. I promise you. I got to hit this slow so it makes sense. Okay? So here's the thing that I want you to think. We're zooming in on a blood vessel. Okay? You have a heart that goes to, pick an organ. Or give me multiple organs.
Lung.
Lung, love that. Can I draw it? Thyroid.
Ooh.
It kind of looks like a tooth. Let's put a hand. Even. Okay, here's why.
Oh,
1, 2, 3, 4, 5. All right. So this is the simple. Okay, in a normal blood vessel, you see the top one. It looks very clean, looks very smooth. You have your vessel walls. The goal of this is we ingest something from our mouth, it gets into our bloodstream, and it floats in here until we absorb it into what we were talking about before, the cells. Remember those little receptors? So there's different receptors for different stuff, okay? So we're going to stick with sugar, which is if you ingest a lot of sugar.
I'm sorry.
That's all right. And you have all this sugar in your body. You have all these toxins in your body, in your bloodstream, right? The very simple is this. There's a requirement. The heart is saying, or the heart is talking to the lungs, talking to the hand. It's saying, I'm going to push blood one direction, and let's just keep it simple. Let's say that the lungs require 100 ml of blood that needs to get there. In a smooth artery, that's what's happening all day, every day, one after another. Bang, 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 pumping and moving. When we start to put sugar in the body, it starts to do this, and this is the visual. If this clinic is the blood vessel, so there's the wall there, and blood's flowing that direction, I come in and I'm sugar, and I bring all my little buddies that are sugar. And here's what we have. Knives in our hands, and we're just scraping the heck out of the wall. Right? We're just running around scraping the walls. So we go around and we're just creating havoc. Okay? My team recognizes there's guys in here scraping the walls, can't get rid of the guys, they call a carpenter. Carpenter comes in to do what to all these little holes that I put in the walls? Who's the carpenter that's produced by the liver? Cholesterol comes in and says, oh, there's some damage, there's some damage, there's some damage. Now what's happening to the canal that's pushing 100 milliliters of blood? It's getting smaller, right? So even though this gets smaller, this requirement is still there. The lungs are saying, I need the oxygen, blood, I need the nutrients, I need that 100 ml. So to keep that requirement there, if this gets smaller, the heart and the pressure has to do what? Increase. What's that called? High blood pressure. Is that because we changed any DNA? No. We started inflaming the cell walls. The Toms running around with knives still are there, right? So it keeps inflaming this and keeps closing. And again, day 1, you're okay. Day 2, week 1, month 1, year 1, you may not notice any of this. Then all of a sudden, you're going to your doctor and you have high blood pressure. What does the doctor then give you? Medication. Does he look at any of this? Does he look at your diet? Does he maybe gives you the exercise more and eat better, right? The classic. So you take a high blood pressure pill. He also notices because you have so much sugar and the requirement from the liver of all this cholesterol is also what? Elevated because we never addressed this. So now we have high BP, high cholesterol, and we're taking what for it? A medication that does this. It just starts to decrease this artificially. I start decreasing the pressure. Guess what starts not being able to make it over here? The lung starts to get sacrificed. So what kind of disease could start to show up there? It's missing, it's deficient in nutrients because we're not pumping what it needs.
COPD, what?
Do you see? Now watch, this is what I'm saying. This diagram changes everything when you think of disease. Name a disease that literally wherever that artery is going to, there's the coronary artery. If it's going back to the heart, we're talking heart disease. You can literally categorize if you have high levels of inflammation and toxicity in your bloodstream, that CRP number, all day, every day for years, months, decades, and your body's reacting and you're treating it with pills and not treating cause, then you're developing disease. Could you have thyroid disease if it's the thyroid? Could you have numbness in your hands? Could you decrease function? Do you see how it just builds? So when I teach people this stuff, I'm like, name a disease and I can show you how this is one of, if not the cause of that disease, right? Now watch, when you start decreasing cholesterol, the body's smart. The body's saying, okay, you're still running around with knives. We never addressed Tom. Like, why haven't you guys addressed me? Wouldn't the solution be get rid of me? Sugar, toxins. If you get rid of me, now we have time to like repair, replenish, do all the stuff. You still haven't gotten rid of me. So since I'm still floating around and you shut down cholesterol in the body, what's the body use from this little guy? Calcium to do what to the arteries? Calcify the arteries. When you hit that threshold, we see it on x-rays. Like, so we see calcified arteries. Do you realize that's been going on for decades of you guys getting treated by your doctor who's stealing the carpenters that are doing their job, and now you're getting what disease when you start stealing calcium from your bones?
Osteoporosis.
Do you see how it just keeps going, guys? And the reason it keeps going is because what are we treating? Are we treating causes or are we treating symptoms? Symptoms all day, every day.
And not asking questions.
And we're not asking questions. So if we just in this example, and again, I've oversimplified this, so I get that. But do you guys get how if you just look at it very simply of now mind you, if this continues to close and that pressure is elevated, that's still a problem too, right? So if we don't take the medication, you're like, oh, Dr. Tom said don't take the medication. The problem is still you didn't solve this and the repair, and so you might still be pressing hard, but that's how if something flakes off, you stroke, right? I love that one because it tells you very easily what are the needs that we need to do, which is minimize toxins, decrease anything that's inflammatory in the body, and then increase fats in the body. So I look at how to reduce your chronic inflammation is this. Processed sugar, no brainer, get rid of it, right? So really look at that and understand that it is the acid in the body that's affecting your arteries and creating inflammation. Change your fat intake. So increase good, decrease bad. So eliminate seed oils. What are seed oils? Like what are some ones that you should not be eating, cooking with, using?
Corn oil,
Vegetables.
soybean,
Palm oil.
So what should you cook with and eat? Olive oil at a lower temperatures, coconut oil can tolerate higher, and avocado can tolerate.
Beef tallow.
And beef tallow.
Great for the tooth.
Healthy fats, fish. Change your meats. So the big thing with meats is what we're, so did you guys ever hear that red meat creates heart disease?
Yeah.
Why does it create, or why do they say that?
Because of everything they pump into it?
It's what they're feeding the cows. So what they're not telling you is grass-fed, no antibiotic, hormone-free, organic grass-fed beef doesn't create heart disease. Here's why. The fat ratio inside the cow and what we end up eating is the 2-to-1 ratio, which is the cell membrane ratio that you want for in and out, right? Keeps the cell healthy. Most Americans, the average omega-6 to omega-3, so it's just a way of saying what's your ratio, is 50-to-1. That means, like I was showing you before, it's high inflammation, bad fats, and you cause all kinds of, you cause signaling issues, and you cause waste that's building in the cells can't get out as well. So changing your meats will change your structure, so stop eating the meat that is not grass-fed, organic. And this is what I mean by your budget should reflect this. I get it. It costs a little bit more, but it saves you so much money at the end when it comes to dealing with your health and avoiding sickness and disease. And then fixing the cell membrane receptors is when you increase that healthy fat, that will naturally happen because your body's going to reproduce that. Supplements for support, you got them right here. So very simple. Wasn't going to spend any time on diving into supplements and the ins and outs of what the supplements do. Just know that, take them. Simple. Minimize product toxins. EWG.org. So women use a heck of a lot more toxins than men, and you'll see a lot more hormonal issues. You'll see a lot more heart disease issues because the toxicity levels are significantly higher. What would we find toxins in that women use that men generally don't? Makeup, right? That's the big one. So if you go to EWG.org, there's a guide on there that just tells you how toxic your makeup is, your hair products. If you think about, take this morning and look at what you did to your body. I took a shower and used 1 bar of soap. I can't remember if I brushed my teeth, to be honest. So toothpaste. And took some supplements, deodorant. So and then you think of it's like mascara, hair, spray, deodorant, shaving cream.
63 chemicals.
Yeah. So, and again, day one, you guys are like, well, it's never bothered me. It's not that, I'm not worried about right today. I'm worried about next week, next month, a year, 10 years, where you're like, I can't understand why my hormones are off and I can't lose. Well, the 10 years of you using products that affected your body is where we're at. So if you want to start the detox, it's a journey. Women don't like that one. Last little slide just to wake you up. This was the recommendation a lot, was just take the daily aspirin, it's no big deal. Here's what they're finding. There was a newer one that just came out about,
2 years ago.
what was it?
So men over 65 were recommended just taking aspirin baseline for
Yeah.
heart disease. And what they found is that men who didn't have heart disease who were taking it prophylactically or who were taking it just for preventative causes should not be taking it at
Yeah.
all. It was actually their risk of mortality was higher because of its blood thinning properties. If they fell, hit their head, it was causing internal bleeding. And so they said, do not,
They just changed the rules, yeah.
Rules, hey, if you're 65 and we're told to take an aspirin prophylactically, that was bad advice.
After they kill enough people, or there's enough, the rules change. And it's no big deal. All those people that were doing it, your kidneys, your liver, your increased risk of cancer. Again, it just doesn't get traced back to it or tracked back to this stuff. So here's how I look at it. I'm a principle guy. You can't outsmart the body. If you dump chemicals in your body and you have no way of getting them out, it will catch up at some point. There's always consequences with chemicals. So if you're going to use something, and you get sick, don't shift to a chemical. Go natural as much as you can. Let your body figure it out so that you don't start poisoning it more. And I love this analogy we always give. It's you take a whole bottle of aspirin, you die fast. If you take one, you just start dying slowly. Like, that's what you're not feeling the immediate effect. You're feeling like, oh, cool, my headache went away, or I feel a little bit better. Number 3, last one. 15 minutes, I'm doing great. Traumas, major, minor, nervous system. Everybody familiar with the term subluxation? It's a fancy chiropractic term that just means that bones have shifted and they're interfering with the spine. Okay? Or interfering, with the nerves. So think about how intelligent God was. You have a brain, a spinal cord, and a nervous system that controls every cell, every tissue, every organ. So as we mentioned, best doctors where? Here, it sends signals to your heart to tell it to beat. If I cut the nerve in half to your heart, what happens to the heart? It's dead. If I squeeze the nerve to your heart, what happens to the heart? It starts malfunctioning, right? So you start losing function. Day 1, fine. Day 3, fine. Week, month, year, 10 years. Problem. And guess what the early symptoms of this little pressure is? It's not heart disease. Anybody neck pain? Tension across their neck? Headaches? Yeah. Guys, so when people come to chiropractors, it's like, oh yeah, they're just going to help me with my neck pain. When we look at your x-rays and we go, oh my God, those same nerves where you're feeling it go into your heart, lungs, organs, we care more about that. We can, again, don't take this the wrong way. We want you to feel good. Feeling good's a side effect of function. All we really care about is how well adjusted can we get you so that we can take pressure off the nerves and let your body function well. So I always tell people the most overlooked cause of heart disease or dis-ease is subluxation. It's your bones shifting out of position from the normal, creating interference. Very simply, and hopefully this lands, the safety pin cycle we learned in school. This is supposed to be a brain, and this is supposed to be a heart, which you guys get. Signals are sent down the spine to talk to the heart, and then signals from the heart are sent back up, right? It's this nice looping cycle. It's a feedback thing, right? So if I'm interfering with this, the easiest way to think of it is every single day, cells are dying. And you guys know this because like skin cells, you actually literally see them flaking off and dying. Heart cells are dying. Liver cells are dying. Now they're not all dying at once, but some of them are dying, and then hopefully what's replacing them? Brand new cells. What coordinates the brand new cells? The brain, right? Or does your cardiologist say, hey, brain, make another 100 cells. We lost 100 today. Your brain is seeing this. It's detecting this. Now watch. In this cycle, okay, I got my brain, I got my heart. Let's just say 100 cells die. It's 100 million probably, or 100,000 cells die. It sends a signal, but we have interference here, back to the brain. The brain only hears 50% of that. So the brain goes, oh, that was a little staticky, but let's make 50%. Day 1. Day 2. Day 3. This interference is subluxation. Now this is on the making the heart. So I am now producing less cells over and over. I'm getting cell death at the heart level. Now does that just apply to the heart, or what if it was the thyroid? What if it was your stomach? What if it was your liver? See how this all works and why the magic of chiropractic is we're looking to identify this, remove the interference, and let the brain do what? Function well. Now it could be the opposite. Say this here, this should be, 150%. It's now producing more cells here. It increased, so you've heard of cardiomegaly, you know the word. You got it. You've heard, so tumor cells in the same deal, it's an overproduction locally at that spot. And so we're looking at this and you guys look at your x-rays like, oh, they're not that bad. They literally, God being as intelligent as he is the only system that's surrounded and protected by bone. It has an ideal perfect position, which is straight front to back. Most people are familiar with that. And then curve from the side. This first one, they call the arc of life. So why do they call that first one the arc of life?
Next to your heart.
Diaphragm.
It's the closest to your brain, and your brain stem sit there, right? There's so much important neurology here, and you guys, you older folks will remember Christopher Reeves, right? Fell off a horse, one bone, the top bone moved the width of a pinky into his brainstem, shut down his body, organs, everything. So he was a healthy, normal, one little movement here, shut it down. So you can see how lower back injuries aren't as concerning as neck injuries. Is that fair? So this arc of life, what's beautiful about this is chiropractors didn't come up with this. When you were birthed, you start crawling, and what does that do to the curve? Starts to develop it, right? So this is an innate intelligence. God wanted this arch, and guess what God knew? It's supposed to be at a specific angle. That angle is, and I didn't write it, 45 degrees. Why 45 degrees? It's the strongest structure known in engineering. So when you guys drive over a bridge, guess what this arch is built at? 45 degrees. Now why? Because math at some point in history figured that out. God knew that from the jump. Because he knew you're going to deal with what? All day, every day, compressing you to planet Earth. Gravity. When you have a curve, you tolerate it perfectly. When you lose that curve, they now can start predicting mortality because of how much tension on the spinal cord and disease. So I show you here that if you lose the curve in the neck or increase hyperkyphosis in the back, it starts taking years off of your life not because of their back pain or their neck pain, but why? What's shutting down? This is severe structural subluxation that if you're not addressing it, again, this is where when we meet you guys and you're here, we're trying to get you back as close as possible. You'll see that they now know that if you can reduce this even a little bit, even in children, your risk of heart disease, cancers, diabetes, all those things go significantly down just maintaining this cervical arch. Forget about diet, forget about fitness, forget about toxins. This is the one that is the aha, and like, how did Uncle Joe make it to 102, smoking, drinking, not eating right, didn't exercise and still made it? It's because his nervous system, lucky enough, maybe he never went to a chiropractor, was dealing with what it was supposed to, removing interference. Chiropractic is just the only profession on the planet that looks at this, and if you're not maintaining these by luck, then we get in there and start to mobilize and adjust this. And there are some cool studies out there. This just shows you the insights on how no tension on the spinal cord, brainstem pressed against the skull or pressed against that top bone, and just it's like a stretching of a rubber band. So when you see these kids nowadays that are doing, like literally, this is all they do all day. Yeah. It's worse than smoking on how many. This is the first time in history that our life expectancy dipped. Multiple reasons to that, but I also, because we're structure based, I think this is a big deal. And they're starting to develop these horns off of their skull. So we all have that kind of bump. These kids, because of how much tension of their forward head, this muscle is so tight that it's pulling bone from the skull. And it's creating like a little horn that wraps down. And no joke, we're seeing it on x-rays now in kids and 20-year-olds. Nerve supply and blood pressure, so I wasn't joking that they have literature that showed this, that chiropractic adjustment better than 2 blood pressure medications from the University of Chicago. It decreases blood pressure systolically 14 points and diastolically 8 points. So there's real stuff that they're showing, but like I said, I don't care much about the science. If it makes logical sense, remove interference to the nervous system that God gave you to heal and function your body. I don't need research on that. I know that every minute that I can keep my nervous system clear, my body's going to be healing and functioning at its highest ability. So action steps, stay well adjusted and mobile. Mobility is the most important thing, your spinal exercises. The craziest thing is these little wobble cushions that you guys do when you warm up. They're probably one of the most important things you guys can do daily. It mobilizes fluid, pumps nutrients up to your brain, and actually there's a ligament that attaches to your heart and massages your heart. So there's like heart benefit just by going through that mobility and pumping of the disc. When should you stop getting adjusted? You guys tell me.
Never.
Right? I mean, and again, it's like, I know that people are like, you go to a chiropractor, you're going to go forever. It should be like, like, why are we going to dentists forever? Like, I always think, like, why are we, like, there are things that we choose to forever, and chiropractic should be number one, not because we are chiropractors, but because it's the profession that deals with the nervous system. And every doctor agrees with that, but there's no plan or strategy outside of us. So when patients ask me that, I'm like, whenever you want to get sick, like you can stop whenever you want. That's my personal opinion is like, it's your body. Just understand the consequences of you're dealing with the minor and macro traumas that if you don't adjust and do spinal exercises, there's just no finish line to anything health. When do you stop exercising?